Thank you so much, Dr. Gupta, for coming on Wellness Your Way. I'm so excited to have you here.
Thank you, Megan, for having me on the show. It's a wonderful show. You are doing such a great work of helping so many people, with all the skill sets and sharing all this knowledge. So I'm really honored to be here and share some bits of information that I can share with people.
And I am equally, if not more, honored to have you because you're talking about such an important topic, which is Hashimoto's. And I am so thrilled to get into all of the nitty gritty about how we manage Hashimoto's, why it's increasing, so much more. But why don't you start by telling the audience a little bit more about you?
Absolutely. So actually, by training, I'm a family physician. And then just out of residency, that's what I was doing, very conventionally trained, treating everybody in a conventional way. Until actually I hit a milestone of my own. I was having a health struggles. Just a couple of years into my private practice, into my family medicine, I was having issues of weight gain. I did not change anything in my diet or like lifestyle. Still, I was gaining a lot of weight. I was very tired. By afternoon, I need to take a nap or just to take a break, just so that I can function through the day. And then at the end of the day, like I was so overwhelmed mentally that I was not able to concentrate on things, was not able to pay attention to things. And then on top of that, I was having this weird stomach pain. The stomach pain will just hit me randomly during the day, sometime during the night. And I could not figure out if any food was causing it or what was causing it, like exactly. And, I thought I'm a smart physician, so let me add some medications to fix the stomach pain. I already started taking some PPIs to see that, it will do the trick. Nothing worked for me. I thought I'm not a smart physician, so let me go to the specialist who can fix me. So I went like specialist after specialist. They did testing, blood work, endoscopies, ultrasounds. Everything was normal. They literally didn't knew what was going on with me and how to help me. They added even more medications, and still my pain was the same. Still my health was not getting better. And I was only 32 years of age at the time, and literally I had no solution, no way forward from there of how to fix myself. So I was totally lost and totally without hope at that point of time. And then that's where, like somebody actually kind of introduced me to functional medicine. They said, well, this functional medicine is a place where people like you go who have all these weird problems and nobody can fix them. So it made sense to me. I started training into functional medicine, got certified into it, and then applied the principles on my own life. I found what were my root causes, made a stepwise plan, of lifestyle changes, taking certain supplements, and see how that works. And within 1 month, bingo, like my stomach pain was completely gone. Within 6 months, I already lost 40 pounds.
Wow.
And then my brain fog was completely gone. I was off all medications. And my energy levels were so good that I even participated in a 5K rugged maniac. And I
Amazing.
was never a person. So for me, because I was never athletic, for me to even participate in a 5K was a big thing. So that was very powerful. Those 6 months of changing things in me, and with a few changes, my whole life transformed. That power I wanted to share with people. I said, okay, well, this is a power I need to share with more people because not a lot of people are talking about it. So I was looking for the best place to work and kind of share this information. And then opportunity came in to work at the Cleveland Clinic Functional Medicine Department because they were doing research in functional medicine. And, they had all these great people, like who wanted to share this knowledge with everybody. So I started working over there. And then suddenly, like after a few months into the practice over there, I started noticing a pattern. I was seeing all these middle-aged females, and they had very similar symptoms as mine. They were all tired. All had brain fog issues. They had gut problems. They had weight issues. And the main thing, they were all doing what their physician wanted them to do of taking medications, but still not feeling good. And one thing was common, all of these females were suffering from Hashimoto's or thyroid disorders. So that what intrigued me. Okay, well, these things, like what's going on with me. So I need to get them better. So I started researching Hashimoto's and thyroid disorders, why they're not getting better, what was root cause playing a role, and why, like we need to do to get them better. So I made this protocol, applied the protocol in several of my clients or patients over there, and bingo, we saw phenomenal results. Again, all of them got better. Their blood work got better. Their thyroid numbers got better. And the most important thing, their quality of life improved drastically. So that what prompted me to kind of become a specialist into Hashimoto's and thyroid disorders. And that, like prompted me to write the book so I can share this knowledge with each and every common person out there and give them hope that, they can get better.
That is so incredible. And I'm sorry that it took your own journey to get you there, but thank goodness you've turned that into good and you're helping so many people now. And Hashimoto's as a specialty is so needed. I am always surprised at how few people have heard of Hashimoto's, even if they do get fortunate to get diagnosed, because we know so many people are underdiagnosed with Hashimoto's, but many people don't know what it is. So for those listeners who have never heard of Hashimoto's, can you explain what it is and how it impacts the thyroid?
Absolutely. So Hashimoto's is an autoimmune condition of the thyroid gland. What happens in the disease is that your body starts producing antibodies against your own thyroid tissue. And that starts a very slow destruction of the thyroid gland, which might take weeks, sometimes months or years to destroy the thyroid gland. And then after the thyroid gland is destroyed, then your thyroid is not able to keep up with the thyroid hormone demand of the body. And that's where people get diagnosed with what we call as hypothyroidism and low thyroid. Now, most of the people, they are only getting checked for low thyroid issues. So they don't even know the real reason of the low thyroid. They are just being told you need to take this medicine forever for your life and nothing else could be done. And they are not doing complete testing to even check whether a person has Hashimoto's disease or not.
Yes, it's so unfortunate. And so I'd love for you to corroborate or add on to what I'm about to say. If your doctor or other practitioner is just mentioning or measuring TSH, thyroid stimulating hormone, and you seem to have all these symptoms, that's not enough. We need to, at minimum, run a more detailed thyroid panel, including T3, T4, free, reverse, etc. But especially for Hashimoto's, the anti-TPO antibody and the anti-TG as well. Do you have thoughts on that, or would you like to add on?
Absolutely. So again, for that, I think a lot of people might not know what we are talking about when we throw in so many numbers. So I like to start with the basics so people understand, where these hormones are coming from. Mm-hmm. So it's very important to understand how your body is making thyroid hormones. So it all starts in your brain. We have this master endocrine gland called pituitary that produces this hormone called TSH, which is the thyroid stimulating hormone. Now, this hormone goes from your pituitary to your thyroid gland, and it's a signaling hormone for your thyroid gland to start producing thyroid hormone. Now, thyroid gland starts producing this thyroid hormone, which is the T4, which is kind of, you can say, an inactive form of thyroid hormone. Now, this T4 actually circulates in your whole blood. But when it goes to your tissues or your cells, it needs to be converted into the active form of thyroid hormone called T3, which your body can utilize. So this is the whole cascade of hormonal production. Now, when you go to a regular doctor, whether you have been diagnosed or even when you get diagnosed, then also the only blood test is being ordered is the TSH, which is not even a thyroid hormone. So that is definitely not telling us what your thyroid is doing. So first of all, it's very important to get a complete thyroid panel. So you first understand where your thyroid lies. As you mentioned, free T3, free T4 are very useful along with TSH to kind of get an idea of where you lie with those hormones. And then on top of it, even then, you're not being checked for Hashimoto's disease. And you need to ask for those antibody levels of TPO, which is the thyroid peroxidase, and the thyroglobulin antibodies. And these tests are available in each and every lab. So you don't have to go to a specialty lab. The same blood draw that you're getting for your TSH, the same blood can be used to check for these antibodies. And the biggest thing is that if your antibody levels are higher than what the range of labs are there, then that is a diagnostic criteria for Hashimoto's. You don't have to go for fancy tests of ultrasounds or biopsies or anything else. Just presence of antibodies says that you have Hashimoto's disease. And it's so important to know How bad is your Hashimoto's disease? How high those antibody levels are? Because that is telling you how many antibodies are present which are destroying your thyroid gland and not letting it function. So it's very important to get a complete diagnosis, because then you know what to do to get better.
Yes. Oh, I am so grateful for you saying this. So let me just reiterate so that we all, the audience all understands, and then we can move on. So the TSH is it's kind of like someone shouting, hey, we need more thyroid hormone. It's a measure of the need for thyroid hormone. Once that TSH gets secreted, then we produce T3, the inactive form, which then gets converted into T4. And that's the goal. That's the really great stuff. But we need to measure all of that to see what's going on. And it's still possible to have low thyroid, even if you do the full thyroid panel. It's still possible to have low thyroid without Hashimoto's. But Hashimoto's is that autoimmune component where the body is attacking its own self, the thyroid. And we only measure that by these anti-TPO and TG antibodies. True?
That is correct.
Okay, great. So one thing that I think people will find interesting in what you said is you were noticing a lot of these middle-aged females with Hashimoto's. And this is scientifically proven. The prevalence is much higher in that demographic. Can you describe to us why that's happening, if you have any thoughts, and how common Hashimoto's is overall?
Absolutely. So first of all, Hashimoto's is the most common autoimmune condition world over. Not
Oh, I
even,
didn't
not
know
even in
that.
United States, world over. Yeah, so it's the
Wow.
number one autoimmune condition. And as you suggested, it is even underdiagnosed. So being underdiagnosed, just imagine that there are so many millions of people running out there which don't even know they have Hashimoto. So it's a very common condition which people are going through. The second question was that, why middle-aged females get diagnosed with Hashimoto's disease. So obviously we do not have a complete research, like what is going on. But what research tells us, the Hashimoto's disease happens because of interplay between our genetic makeup and the environment around us. And the environment can be anything. It can be food, it can be toxins, it can be stress, it can be deficiencies, any of those things, right? Now, middle-aged females, they have an added advantage, I will say. They have these hormonal shifts that happen to them more
Yes.
often than anybody else, right? Because every month, they are going through these hormonal cascades of estrogen, progesterone, those menstrual cycles they are going through. Their female hormonal system is much more fragile and complicated as compared to a male hormonal system.
Yes.
And what we have seen is that that gets more affected with the toxins we get exposed to, right? We are seeing like more and more females, especially young females, are getting their menstrual periods at a very young age. The reason being, we are getting exposed to these external xenoestrogens, which are present in our environment, right? So that is the reason that, females have more toxin exposure. They have these cyclical changes and they are more, prone to stress, because we
Yes.
see that, pregnancies, postmenopausal, as well as any kind of life stressors, like females get exposed to, again, that hormonal shift happens and that exposes them for more autoimmunity. So I think
Yes.
those are the main reasons that females are more prone to any autoimmune diseases, especially Hashimoto's disease, as compared to males.
Very interesting. So if I'm understanding you correctly, it's both a slow build and maybe a triggering event. Well, we need to have the genetic predisposition, but then the slow build might be the toxin exposure over the course of our lifetime and the stress and the hormonal shifts and all this. And then maybe for some people, there's a triggering event, like you get a virus, you go into menopause or something like that. Does it need a trigger, or is it more a slow build up plus genetics?
So we don't know exactly, but most of the females will have a slow build-up component, but definitely a trigger also.
Okay.
But the trigger sometimes might not be very big, because again, there are different stages of Hashimoto's disease, and because we are only checking for TSH, we miss the stage one of
Yes.
Hashimoto's, where we are just having the antibody levels and it has not yet affected the TSH levels. So I think that
Yes.
goes undiagnosed diagnosed for a long time. So that's the reason we are not able to find those triggers, because they might be hidden like 2 years or 3 years before they were actually diagnosed with a thyroid disorder.
Very interesting. Okay, so certainly if someone has Hashimoto's in their family or has other autoimmune conditions, and especially if they're a middle-aged female, we would definitely recommend these tests at any sign of low energy, fatigue, something like that. What other symptoms would you say are common in the onset or the continuation of Hashimoto's?
Absolutely. So there are a wide range of symptoms with Hashimoto's disease gives. So starting from the brain, most, like people will complain of this brain fog, where forgetting things, they're not able to concentrate on things. ADHD like symptoms, that they suddenly, they are trying to multitask, but they're not able to remember like what they were doing. And then, mood changes, feeling depressed, feeling anxious, like feeling stressed out. Then having gut issues with constipation, diarrhea, bloating, all of those problems. Then having infertility issues. Then feeling cold all the time. Then having
Yes.
hair changes like hair thinning or hair falling. And then, as you mentioned, feeling tired all the time, or feeling like, they don't have any energy, right? And then having skin issues where the skin is very dry, or like, hives, so all of those symptoms and signs are present. And then, as we discuss, weight issues where they are gaining weight or not able to lose weight. So a
Yes.
whole bunch of symptoms are associated with Hashimoto's disease. And I think if anybody has any of these symptoms, along with a complete thyroid profile, they also should check the antibodies just to make sure that they don't have early stages of Hashimoto's.
Yes, that's a really tough list of symptoms. Maybe the cold is and the hair falling out, they're pretty exceptional. But I'm guessing that a lot of middle-aged females, which is the bulk of my audience, they're saying, oh, yeah, I kind of have brain fog. I kind of have reluctance to lose weight. I'm feeling a little tired. So a lot of these symptoms could be multi-causal. And also, if you have Hashimoto's, you might not have all of these symptoms, every single one. So it's a little bit tough to diagnose just on the symptoms alone, I would say. Yeah.
Absolutely. And that's the unfortunate piece of it, that we just don't have one particular symptom that bingo, okay, well, this will actually, if you have it, then it is diagnostic of Hashimoto's.
Yeah.
And that's also the reason that females have to suffer for years before
Yeah.
finally they get a diagnosis, because they have been poo-pooed out like for such a long time. They will go to the physician, as you said, well, this is normal, you just, like delivered a baby, that is normal. Oh, you are a mom of 2 kids and you have a job and you're taking care of your parents and you're managing your house, so obviously you have all of these symptoms, so nothing big about it. So just go home and just de-stress, don't take too much stress, right? So that's the reason females obviously kind of gets neglected and their health get neglected. So I always say, have a high index of suspicion. Doesn't hurt to get the blood work done just to be on a
Yes.
safer side. And because if you do have it, then you can do things to get better.
Yes, absolutely agree. So let's start talking about getting better, because this is where you give us a lot of hope. I'd love to start by clarifying a little bit of what you said earlier, how the conventional approach differs from the integrative or functional medicine approach. And just take that wherever you would like to go.
Absolutely. So again, a lot of people are not understanding how Hashimoto's disease happens and what is a treatment for it. Because when they go to the conventional doctors, even though they have been diagnosed with Hashimoto's disease, most people think the medicine they are being given, the levothyroxine, that is actually treating Hashimoto's disease. In reality, it is not doing anything for Hashimoto's disease. Levothyroxine is a thyroid hormone, external thyroid hormone that has been given to your body to support your thyroid gland, because your thyroid gland has been destroyed and not able to keep up with the demand of the body. That's a band-aid that has been given to your thyroid, and nothing is being done to the underlying destruction which is happening to the thyroid gland even when you are taking the medicine. So it is very important to kind of lower the antibodies, safeguard your thyroid gland from further destruction, so that first of all, you can save your thyroid gland. Second of all, so that you don't have to keep on increasing the dose of medicine in the future. And third of all, reach that point where your thyroid is destroyed completely, that you have to take the thyroid hormone medicine for lifelong.
Yeah.
So that's very important to understand. And a lot of people are not even understanding that the levothyroxine is not doing anything to work on the underlying inflammation. Now, again, I'm not saying everybody to stop the medicine, throw away the medicine in junk or trash. That's not the case.
Right.
What I'm trying to explain is that, there are two different components. One is the low thyroid and one is the inflammation or the autoimmune component. So if you need medicines, absolutely you need it. Nothing wrong with medicines, okay? But to lower the dose of the medicine or to get your quality of life back, then you need to work on that inflammation or autoimmunity. Now, research suggests currently that people who are taking medicines, levothyroxine for Hashimoto's disease, and their thyroid numbers are within normal range, 60% or more of those people will continue to suffer from symptoms even after taking the medicine. So if you are that person, you're taking the medicine, still not feeling good, then you need to definitely work on that autoimmune process to kind of safeguard your thyroid and get the quality of life that you deserve.
Amazing information. So the thyroid replacement hormones, these are, going back to the beginning of the conversation, these are repleting, depending on the medication, T3 or T4 or some combination of both. And so that's fixing the low, or in quotes, fixing the low thyroid hormone availability in your blood. But what's not fixing is the root cause, which is that the body's still attacking the thyroid and destroying the thyroid gland through that autoimmune process. And we fix this through targeting the root causes of this inflammation and this autoimmunity. And I am guessing that you're going to say the root causes are multifactorial, their diet and their stress and their toxins and their many of these things. But I'd love to start with diet because that's my favorite wheelhouse to be in. So can you talk to us about some of the diet modifications that you might suggest for people who have been diagnosed with Hashimoto's?
Absolutely. And you correctly pointed out, lifestyle changes definitely are the cornerstone, of any Hashimoto's disease patients. So that's first place that people should be starting. And diet is so important, right? We all have heard food is medicine, but at the same time, if you're eating the wrong foods, that can definitely lead to Hashimoto's disease. Mm-hmm. Now, obviously, so what I categorize diet is that, in two components. One is food, which is bad, so you need to remove it. And the one other category is the food, which is good for your thyroid or Hashimoto's, that you need to include. So the food which is really bad for Hashimoto's disease, we know that, there are certain foods which have been associated with it, like gluten, like dairy, soy, corn, sugary foods, then processed foods, processed meats. All of those food have been associated with autoimmune diseases because they increase inflammation in our body. And by increasing the inflammation, it causes leaky gut problem. And that leaky gut ultimately leads to the autoimmune process like Hashimoto's. And that's where everything starts. So very important to kind of, stay away from these foods so that, you can lower the inflammation, and that also helps to lower your antibody levels. And then the second component comes is the food that is actually healing for your body. So the first food in that is non-starchy vegetables. The more colorful vegetables you will have in your diet, the better profile of vitamins and minerals you are getting. Because each and every color that a vegetable has they have different antioxidants, different vitamins, different minerals associated with it. And thyroid gland needs multiple vitamins and minerals to produce thyroid hormone. So it's very important to eat all of these different kinds of vegetables so that, you can get the right vitamins, minerals, fibers, all of those things for your body. Then comes a good quality protein. We need good quality protein to sustain again our thyroid. So in that aspects, like chicken, fish, turkeys, those are great sources. If you're a vegan or a vegetarian, for me, even if you're doing lentils, legumes, beans, nuts and seeds, those are also okay to include them, on your good quality protein diet. And then comes the good quality fats. Now, a lot of people are scared of the fats, because we have created this, scares that, okay, well, each and every fat is bad. But what we forgot was that there is good fat and there is bad fat. What we need to tell people is that bad fat is bad, stay away from it, which is the fried food, which is the processed food that we are eating. We need to stay away from it. But we need good fat. 60 to 70% of our brain is made with fat. So if you're not eating that fat, our brain is not going to function. Your hormones are made from fat. So again, we need that good fat. So again, including those olive oils, your coconut oils, your avocados, your nuts and seeds, almonds, walnuts, chia seeds, fatty fishes, all those are good fats that we need to include in our diet to support our thyroid and support our cells. And then comes the grains, like gluten-free grains, if you want to include some of them, like maybe quinoa or maybe some brown rice in a limited fashion or a quantity, those are also okay to do. So if you do this diet, which includes food which is supporting your thyroid and removing foods which is causing inflammation to the thyroid, that is very powerful. We have seen so many people improving just by doing these dietary changes. Their antibody levels gets better, their thyroid numbers gets better. They have more energy on this kind of diet. Their body feels good in general. So I think this diet is very cornerstone of each and every Hashimoto's patients.
Oh, Dr. Gupta, this was so incredible. I just want to take that last couple of minutes and repeat it over and over and over. And I encourage people listening to rewind it because it was so important that these things that we think are just platitudes or something like that, eat more vegetables, they actually make a huge difference. Our thyroid needs those antioxidants and micronutrients in order to function appropriately. And those help us cool down the inflammation. So more vegetables, good quality lean protein, a lot of the healthy sources of fats, and then gluten-free grains if the person wants to. I think that's a wonderful foundation. And I will say for the clients that I work with, and again, caveat, I'm not a doctor. I work with clients as part of their healthcare team, but I've helped many, many clients manage Hashimoto's. We'll do 100% on gluten, absolutely 100%. But those other ones, we like sugar, for example, it's really hard to do literally 0 grams of added sugar for the rest of your life. So we won't go 100%. We'll just make efforts to reduce some of those other things. What do you think about that 100% versus mostly?
So again, what I feel is that whenever people, when clients are working with us, they are in a really bad situation. They have like all of these gamut of symptoms. Their body is literally not functioning. There is too much inflammation in the body, and everybody wants to get better tomorrow, right?
Yeah.
Because I was in that boat. When you're suffering, you don't feel good. You want to do each and everything to get better tomorrow. So what I figured out is that do an intense program of maybe 2 or 3 months where you kind of remove everything, kind of a detox for your body by removing each and everything which is causing burdening of your body, and then including everything to heal your body. Once after 2 or 3 months, your body is in a better state of healing. Then even if you take certain amount of hits, by including certain sugars or by kind of, cheating here and there, then the body does actually good and you can sustain that. So we have this 4-month program where we do work with our clients very intensely. But after that, once they're exiting the program, we tell everybody that, nobody can be 100%. So don't bother about trying to be 100%. Even if you are 70 to 80% on the diet, that still works. So yes, if once in a while you are going to enjoy, don't feel bad about it. Don't try to be kind of type A personality where, okay, well, everything has to be structured and you don't, like enjoy life at all. Always tell people, just try to take it easy. Try to do everything in moderation. You will be okay. But those initial 4 months definitely be a little bit more intense because you want to get everybody better. And that's the reason we see great results. Each and every client that works with us for those 4 months, they see phenomenal results. All of their symptoms go away. The thyroid antibodies improve. Their whole life changes. But I absolutely agree. We definitely cannot take fun out of the life. And there has to be some options of fun which should be left.
That's really amazing. And I think once people start feeling so much better, like they do with your program, then going back to the quote, old way of eating, it becomes less appealing. You say you don't want to take fun out of your life, but I would argue that it's really not fun to feel like junk every day. So it's more fun to find some healthy foods that you like and learn new preparations and things like that, which I'm sure your team is really great at guiding people in, and to feel good all the time. And then, like you said, little mini excursions after the 4-month protocol, I fully support, but no one wants to feel like junk. That's more fun than any food. Feeling not like junk is more fun than any food out there. Yes.
Absolutely. Like when people come to see us and start working with us, they said, like, I'm a food junkie. I just love food. So there is no way that, like I'm just going to wait for these 4 months and I'm going to go back to where I was. And I was like, okay, well, let's try these 4 months. Then, you are feel free to do what you want. And as you
Yes.
correctly pointed out, after 4 months, they feel so great. They completely flip out and they say, Dr. Gupta, there is no way. There is no way I'm going to feel like trash the way I was feeling before. And I'm going to follow this diet and these things because as you said, absolutely. They said, I don't want to feel that way. If I have to make a few changes and that will give me more better quality of life, I can enjoy more. Why not? So
Yes.
it's just doing those tough few months and everybody feels so great. And absolutely nobody wants to feel the way they were.
That's really incredible. So diet, like I said, is my favorite, but there are other lifestyle aspects that I'm assuming are part of your protocols. I'm imagining things like sleep and stress reduction and all of that. So why don't you tell us one or two of your other favorite parts of the protocol, and give people more details on that?
Absolutely. So stress definitely is very important. The current life we are living in, we get exposed to stress day in, day out. And when I talk about stress, everybody's thinking about mental stress. Well, we are not just mentally stressed out. We are physically stressed out, mentally stressed out, spiritually stressed out, emotionally stressed out. And each and every stress affects us physically, our body. So we have to incorporate some de-stressing techniques or exercises on the daily basis so we can kind of build that resilience to fight off that stress. Because to be very frank, like we all will get exposed to some kind of stress. There is no way that I can say, well, like if you do these certain things, then there'll be no stress in your life. We all will get exposed to it. So we have to develop those techniques, whether it's deep breathing, whether it's meditation or journaling or developing certain hobby, any of those things. 10 to 15 minutes in a day, that's it. If you just do those for 10 to 15 minutes, that actually breaks that stress response and that can improve your body a lot. A very important part of the thing, a lot of people don't pay attention to it and they feel they need fancy supplements and everything to do it. I tell them this stress response, if you modify it, that will give you much more benefit than any supplement out there. So
Yes.
please incorporate some kind of stress reduction techniques on the daily basis, whichever you like, whichever you kind of resonate with. Again, there are 1,000 different techniques of meditation or stress reduction out there. And people are finding that one which is the best out of them. I tell people all of them work. You just need to find one that resonates with you that you can go back to each and every day in your life. So once you
Yes.
find it, just use it. That is going to be very useful. So stress management is very, very important. And sleep. We are not sleeping enough. Again, there was a research study done 2 years ago, which showed that more than 60% of Americans are not getting good quality sleep.
Mm.
And we know that sleep is so important because we are healing our body during the sleep. We are resting our body so that we can get ready for the next day. And, it obviously reduces inflammation in the body. So it's very important to prioritize sleep over everything and get that 7 to 8 hours of good quality sleep. Without that, your body cannot heal. Without that, you are kind of not able to lower the inflammation. So please prioritize that. It's very, very important to do it. And then comes the exercising piece of it. Like exercise again is a two-edged sword, especially
Mhm.
for Hashimoto and thyroid. Because when people come to see us, they're literally broken down. Their body is broken down. So if we want them to exercise too much, that is actually doing a disservice to their body because the
Yes.
body will not able to handle. And then they feel even worse. So I tell those people, don't do exercising right now. We need to heal your body first. Once your body is a little bit more healed up and ready to take their exercise, then we do it. So that's what I tell all of the Hashimoto's and thyroid patients. If you are exercising and after doing exercise, you're completely done for the day or you completely feel wiped out, that means your body is not ready for exercising. That's not a good time. But if you're not feeling that way, then definitely including exercise or body movement is great. Any kind of cardio or any kind of strength training, just mix them both. And that's the best kind of exercise that people can do. Obviously, exercise is so variable. That's where, everybody needs to know your baseline like a practitioner who knows what is your baseline about exercising and then build on top of it. But I always tell people start slow. That's the goal of exercising and then build it up. Then that way you're not harming your body, not hurting your body, and you're doing it the right way. So I
Yes.
think these are all the lifestyle changes that will definitely be very, very useful for Hashimoto's clients.
That's really wonderful. And I think for all of those, it might require a little experimentation. I have so many clients who are, maybe I attract them because I'm type A too, but type A, high achievers, go, go, go. And I suggest something like a breathing exercise or meditation. And they say, oh, I tried it. It didn't work. And I say, okay, maybe you tried it one time. That's really great. But we need to practice these things. And like you said, experiment and find what works for you and then latch onto it. There's not one thing exercise wise or stress management wise. Maybe there are a couple things sleep wise that are good for everyone, but in terms of the others, at least it does require a little bit of experimentation and customization. So keep trying. If you're listening to this and you haven't found your thing yet, keep trying. That's important. Okay. I'm imagining just like those need to be customized, supplements definitely need to be customized for the person. And so I think you might not have an answer to this question, but I'll try anyway. Are there any supplements that you feel are super helpful for all or most people with Hashimoto's?
I think so. I think there are certain supplements which I feel that a lot of Hashimoto's clients could benefit from.
Right.
And again, as you said, like before taking any supplements, making sure that, it is right for you, for your body, as well as, works for you. So that's
Yes.
very important. But some basic ones are like vitamin D, right?
Mm.
Like I don't even talk about vitamin D so much because I think each and everyone knows how important it is. But again,
Yes.
I like to remind people, like vitamin D is such an important vitamin needed by each and everything in your body, especially for your thyroid gland. You have
Yes.
several research studies suggesting that vitamin D is very useful for Hashimoto's and thyroid in general. It reduces inflammation, improves body's immunity, improves thyroid functioning. So all of those things, like vitamin D is already doing. Again, easy blood test to do. So, get your doctor to check your vitamin D levels. If you are low or in the low normal range, then you need to add that. Very simple vitamin, anybody can get it. The second vitamin is selenium. Especially for Hashimoto's clients, there are at least 10 plus research studies which shows that selenium can lower antibody levels for Hashimoto's disease. And most of the people are low in selenium because there are not many foods which are high in selenium, and plus our food itself is low in selenium. So that's the reason sometimes supplementation could be useful for the selenium that people can take for Hashimoto's disease. Then next comes the zinc. Now, zinc and selenium actually work, in tandem with each other, because most of the research studies says that zinc, when taken along with selenium, actually have an additive effect of lowering the antibody levels even further than what selenium alone can do. So that's the reason I recommend doing selenium and zinc together, because that additive effect of lowering the antibodies and supporting your thyroid is great when you're doing that. The last supplement is magnesium. Magnesium is kind of one of those minerals which again, like is important for more than 300 enzymatic processes in our body. So literally like each and every cell like is using magnesium all the time. And again, we are not getting enough magnesium, so it is very important to get it. The good part is that there's not much side effect of the magnesium and it can be helpful for so many things. So that's again, magnesium can be useful for the thyroid patients. So I think these are good foundational supplements which a lot of people can use if taken appropriately and in appropriate dosages. I think they can help a lot of Hashimoto's patients. And beyond that, obviously, there are specific supplements for specific situations, and those are more customized or personalized for different Hashimoto's patients. But I think these, like most people can take easily.
Those are so wonderful. Thank you for that. And I just know that people are so eager to learn more from you and more about your protocol. So can you talk to us about your book? Tell us where to get it. Tell us what we're going to get when we get the book and what we'll learn. Tell us about your programs, anything you want, so that people can learn more from you and your team.
Absolutely. So, like the idea of writing the book, the book name is called Reversing Hashimoto's. It is available, on Amazon or all the major platforms. The idea of writing the book was that there are other books which have been written in a very heavy language, a very medical language. And a lot of people after reading those books, just feel overwhelmed. They don't know what to do and they do not understand exactly what was still going on with them. So I wanted to write a book where people can easily understand what was Hashimoto's, what is going on in their body, why they're not feeling better. And then plus, what I'm sharing is research based. So those are the two main things that I wanted to cover. And that's where I started writing the book. So book is a very easy read. Anybody can complete the book like maybe in a few days, 4 or 5 days, but it's still research back. So at least more than 150 references of research studies of what I'm talking about, so that at least people have some authority saying that, okay, well, there is some evidence behind what we are doing. And then, kind of write the book in the 3-step process. So 3 steps, involving the very first step is actually finding that root cause, or causes, as we say, right? So as we discussed, there are 5 major root causes which are playing a role in Hashimoto's: food sensitivities, toxins, stress, infections, nutritional deficiencies, all of those things. So we talk about how many root causes might be playing a role. A lot of people make this mistake that they're looking for just one root cause. What I have identified is that most people will have at least 2 plus more root causes which are playing a role in Hashimoto's disease. So I kind of give them some questions over there that might help them to identify potential root causes that are playing a role. So that's the very first step, we discuss in the book. The second step is, kind of start healing the body. That's where I talk about this diet that we discussed, telling them in detail about what food to eat, what not to eat, what are the benefits, and certain supplements, that can help start healing their thyroid. And the last step, which is the step 3, is basically removing the toxicities. Removing the toxicity of stress, removing the toxicity of infections, and removing the toxicity of environmental toxins. So that, you reduce the burden in your body, and so that your thyroid even works better.
Yes.
So those are the 3 steps I'd kind of discuss in the book, in a very practical way, so people can read it and start applying those things today itself and have a better understanding of what is going on with them. So that's what the book is all about. Again, they can get on Amazon, they can get it on Kindle, they can order the book wherever they are in the world, so they can use it and kind of work with it. Beyond the book, when people have implemented those basic things and still they want more, or they want a more personalized approach, that's where we come into place, where we offer that like personalized 4-month program to people, where they work with us one-to-one. The good part is that now we are a completely virtual practice. So literally from people from anywhere in the country can work with us, where we take them on this journey of healing their thyroid, healing their body, and actually rejuvenating their thyroid, so that their like body gets better, their quality of life gets better, plus their thyroid numbers also get better. So they can find more information about us, obviously on our website, which is anshulguptamd.com. We have a very active blog that I write, like on the monthly basis, sharing a lot of information. I'm very active on YouTube. So I have a YouTube channel where, again, I share small videos of people regarding Hashimoto's and thyroid. The handle is Anshul Gupta MD, where people can follow us over there. Obviously, we are on Instagram too. So depending on where people want to find us and how they learn, by reading, watching, or listening, we are present everywhere else.
Oh, that's so amazing. You, again, are doing such a great service to people. And I will be sure to link in the show notes to the book, your website, your YouTube channel, your blog, everywhere where people can learn more about you and continue to get help from you. But I already know today you have changed so many people's lives who feel like Hashimoto's was just something that they had to live with. You've given them hope, and I really appreciate your time and your insights today. Thank you, Dr. Gupta.
Thank you so much for having you on the show. It was really a pleasure.